Full thickness graft can be obtained from all of the following except axilla. So full thickness graft can be obtained from groin, supraclavicular area and elbow. Koch's peculiar tumor is ulcerated sebaceous cyst. Tumor with perineural invasion, adenoid cystic carcinoma. A Wolfe graft is a small full thickness skin graft. Burns. Exposure treatment is done for burns of the head and neck. Rule of 9 to estimate surface area of a burnt patient was introduced by Alexander Wallace. Deep skin burn is treated with split thickness graft. In burns, heat loss is by or due to exposed area by evaporation. The cold water treatment of burn has the disadvantage that it increases the chances of infection. An adult whose both lower limb are charred along with genitalia has 37% burns. Pus in burns form in 2 to 3 days. One of the following is not seen in severe burns. Hyperthermia is not seen. Hypovolemia, sepsis, and duodenal ulcer is seen in severe burns. Undue restlessness in a patient during the immediate post-burn period is often a manifestation of anxiety. Calculate the percentage of burns on the head, neck, and face in a child of 1 year. So none of these options. All requires hospitalization except 5% burn in children. So which of these require hospitalization? 10% scald in children, electrocution, and 15% deep burn in adult. Late death in burn is due to sepsis. Burns with vesiculation, destruction of the epidermis and upper dermis is second degree. True about burns. Hyperglycemia is seen in early burns. Head and neck involvement in burns in infant is 18%. Metabolic derangements in severe burns are all except increased secretion of HCl. So which are the metabolic derangement in severe burn? Corticosteroid secretion, hyperglycemia and neutrophil dysfunction. Superficial burns, true is blister formation can be healed within 7 to 10 days. True statement about burn resuscitation, half of the calculated fluid given in initial 8 hours. Diuretic should be given to all patients of electrical burn. A burn patient is referred when scald in face, 25% deep burn in adult or burn in palm. The ideal temperature of water to cool the burnt surface is 15 degree. Indications for specialist referral in burns is more than 20% superficial burn in adult, only palms, scalds on head and face, 10% burns in infant, 10% deep burns in adult. The best guide to adequate tissue perfusion in the fluid management of a patient with burns is to ensure a minimum hourly urine output of 30 to 50 ml. A third degree circumferential burn in the arm and forearm region. Which of the following is most important for monitoring? Peripheral pulse and circulation. In third degree burn, all are seen except it is not painful. So what is true? Vesicles are absent, leathery skin, reddish due to hemoglobin infiltration, and it is not painful. IV rule for burn is percentage body surface area into weight in kilograms into 4 is equal to volume in milliliter. In a patient with the burn wound extending into the superficial epidermis without involving the dermis, anesthesia would present with all of the following except anesthesia at the site of burn. So what would be the presentation? Healing of the wound spontaneously without scar formation, blister formation, and it is painful. What is the most important aspect of management of burn injury in the first 24 hours? Fluid resuscitation. Treatment of burns include no bandage to head and neck, superficial burns without blister, no need of dressing, escharectomy done for peripheral circumscribed lesions. Most common cause of death due to burn in early period is hypovolemic shock. A 50-year female has 2 deep burn involving 45% total body surface area (TBSA). Regarding her management, which of the following statement is true? Half of the calculated fluid should be given in initial 8 hours. 9 liters of ringer lactate should be given in first 24 hours. CVP line should be inserted. What are true regarding 20 deep burn? Dry white color, second degree deep burn. Dry white color and predisposed to hypothermia. True about thermal burn injury, middle layer is zone of hyperemia. Zone of stasis is associated with vascular damage. Fever in burnt patient is caused by septicemia and due to hypermetabolism. Which of the following statements are about post-burn neck contracture occur because of conservative management of deep burn, treated by flap, obliteration of cervicomental angle, and dental abnormalities may be present. A tumor arising in a burn scar is likely to be squamous cell carcinoma. Fever in burnt patient is caused by septicemia due to hypermetabolism. An adult whose both lower limbs are charred along with genitalia has 37% burns. Arterial disorders, maximum tourniquet time for the upper limb is 1 to half hour. Thromboembolism after pelvic surgery, usually from the veins femoral. Most common cause of death in patient with Berger disease is myocardial infarction. Which of the following best respond to sympathectomy? Hyperhidrosis. Intermittent claudication at the level of the hip indicates bilateral iliac artery occlusion. The artery commonly involved in cricoid aneurysm is superficial temporal. Pulsating tumor include all except secondary from prostate. So pulsating tumor include bone sarcoma, osteoclastoma, secondaries from hypernephroma. Preferred material for femoropopliteal bypass, saphenous vein. Most common cause of aneurysm of abdominal aorta is atherosclerosis. The most common complication of an aortic aneurysm size 8 cm is rupture. Management of a cause of iliac artery embolism requires embolectomy. Intermittent claudication is caused by arterial insufficiency. Berger disease is seen in only male aged less than 40 and smoker. In the abdomen, aneurysm of the splenic artery commonly occur next only to the aorta. Congenital AV fistula in the thigh will be associated with all except increased skin temperature. So it will be associated with increased cardiac output, gigantism of limb, and superficial venous engorgement. In extraperitoneal approach to left sympathectomy, the following may be injured: ureter and gonadal vessels. Lumbar sympathectomy is indicated in TAO with skin changes and Berger's disease. Commonest site of thromboangiitis obliterans is none of these. Treatment of acute femoral embolus is immediate embolectomy. Ganglion which is spared in lumbar sympathectomy is L1. Vessels most commonly involved in thromboangiitis obliterans anterior and posterior tibial. Following are used in treatment of Berger's disease except anticoagulation. So Trental sympathectomy and antiplatelet is used. For aortic graft, the best material available is Dacron. In a lumbar sympathectomy, the sympathetic chain in its usual position is likely to confused with the psoas minor, genitofemoral nerve, and lymphatic. Bullet wound near major blood vessel should be explored only if the pulse is weakened, there is no pulse. A knitted Dacron artery graft can be easily incised and the opening resutured. The sequence of symptoms in pulmonary embolism is dyspnea, pain, hemoptysis. A useful through temporary improvement in a patient's ischemic foot can be attained by giving intravenously dextram 40. Diabetic gangrene is due to ischemia, increased blood glucose, altered defense by host, and neuropathy. All are true about embolic artery occlusion except muscles are unaffected. So what is true about embolic arterial occlusion? No previous history, pulse is absent, anesthesia is present. All are true about Raynaud's phenomenon except atherosclerosis of vessel. So what is true about Raynaud phenomenon? Exposure to cold aggravates spasm of vessels, more common in females. The commonest site of lodgement of a pulmonary embolus is in the territory at left upper lobe. Kaposi sarcoma is commonly seen in lower limbs. Which of the following causes maximum bleeding? Artery caught between fractured ends of bones. In a 40 years old male, thrombus in the common femoral artery is because of atheroma. One of the following is not indicated for arterial leg ulcer. Elevation of limb. Not used as graft material in peripheral vascular disease (PVC). So what is used as graft material? Dacron graft, vein and PTFE. The commonest cause of arteriovenous fistula is congenital. AV fistula leads to all except cardiac arrhythmia. They may lead to sinus tachycardia, increased preload and increased cardiac output. Commonest peripheral aneurysm is popliteal. Popliteal aneurysm, all are true except uncommon among peripheral aneurysm. No, it is commonest. So what is true? Presents as a swelling behind the knee, presents with symptoms due to complications. Surgery is indicated in case of complication. Graft used in infrainguinal bypass is autologous vein. True about erythrocyanosis except palpable pulses. So what is true about erythrocyanosis? It affects young girls, cold peripheries and ulceration and gangrene of fingers. Diabetic gangrene is due to all except vasospasm. So diabetic gangrene is due to atherosclerosis, peripheral neuritis, increased sugar in blood. Pseudoaneurysm are most commonly due to trauma. Bilateral pulseless disease in upper limb is caused by aortoarteritis. AV fistulas causes increased venous return. Nicola-Doni-Branhan sign is compression cause bradycardia. Abdominal aneurysm is characterized by all except emergency surgery complication less than 10%, rarely asymptomatic before rupture. These both are incorrect. So what is true about abdominal aneurysm? Elective surgery complication should be less than 5%, and bigger the size, it is more prone to rupture. Dissection of which artery is seen in pregnancy? Aorta. Berger's disease affects all except multiparity and first pregnancy after 30 years. So Berger's disease affects small arteries, small veins and medium-sized arteries. Berger disease is associated with smoking and superficial thrombophlebitis. True regarding AV fistula is it leads to cardiac failure, causes local gigantism, can cause ulcers, cause excess bleeding on injury. True statement of Berger disease is small and medium sized vessel involved, common in male. In which one of the following condition dactylitis cannot be seen? Beta thalassemia. Complication arising out of AV fistula done for renal failure include the following except necrosis of the distal part. So complications include infection, thrombosis, high output cardiac failure. What is not seen in sudden onset peripheral arterial occlusion? Ruber is not seen. Drug used for Berger disease, xanthinol mycotinate. Pseudoarterial aneurysm in drug abusers seen in carotid.